Good morning.
Good morning.
My name is Susan Rosas, Chief Executive Officer with YWCA Kalamazoo, and it is a pleasure to invite you all back into our space today in partnership with our local nonprofit leaders whose work is dedicated to serving the Kalamazoo community every day. In April, I and many other nonprofit leaders stood in this very room with a message to our community and our elected leaders that our sector was losing critical funding and that we could expect terrible harm to come as additional cuts were on the horizon. Since then, we have seen many of our nonprofit partners begin to restructure, lay off staff, and reduce programming. Under this administration, Kalamazoo has seen $51 million in federal cuts from social services, from only this community, almost overnight. 123 Kalamazoo families who had committed their livelihood to nonprofit work have been thrown into joblessness in the last few months. We've seen a multitude of programs close across the county, ranging from housing programs to crisis support to education programs and treatment services. Here in Kalamazoo, our nonprofits have joined in coalition to do all we can to mitigate the devastating impact of these funding losses and policy shifts that will hurt our community. We hope to buffer these cuts to the best of our ability because our community deserves better than the cruel decisions being made about us, without us in Washington, D.C. Now, as our sector braces for the influx of needed support for this community caused by inhumane federal policy, we are dealt another blow. On August 26, Michiganders saw House Republicans present a new budget, HB 4706, which, if passed, would dramatically cut additional services from Michigan communities across the state, including here in Kalamazoo. 68% of Kalamazoo nonprofits expect to see state funding losses as early as October of this year. In this proposed budget, House Republican leaders have included approximately $6 billion in funding cuts from several Michigan state departments, including the Department of Agriculture and Rural Development, the Department of Corrections, the Department of Environment, Great Lakes and Energy, the Department of State Police, and what may impact many of us today, the Department of Health and Human Services. Cuts to these departments and others mean cuts to essential programs that protect our communities. They reduce crime, they house or unhoused neighbors, they protect survivors, they ensure the health and survival of infants and of mothers, and they support sustainable and healthy environments for all individuals and all families. In addition to these dramatic cuts, House Republican leaders have also proposed language that attacks immigrant families, queer community members, and the pursuit of equity and belonging. Should this proposed state budget move forward as proposed, organizations and the most vulnerable individuals across Kalamazoo will undoubtedly face serious and immediate long-term harm, this time at the hands of our very own state representatives. House Republicans created a new process for appropriations this year, purportedly in the spirit of transparency, but did not allow for nonprofits like ours to participate in that process, even when we followed all the rules. The budget draft was not made in partnership with communities, and our voices were not invited in, and so we are using our voices today. As nonprofit leaders who diligently and responsibly serve so many individuals in this community, we cannot remain silent about the hazardous outcomes that a funding shift like this could have. Today, you will be hearing from several members of Kalamazoo's nonprofit coalition to speak to the potential impact that the budget, as outlined in HB 4706, would have on some of Kalamazoo's most trusted and needed resources. I invite Kelly Kellis, President and CEO of Disability Network Southwest Michigan, to the podium. Thank you.
Good morning. Thank you for being here today. I want to talk a little bit about the Michigan House budget and what that means for people with disabilities and for all of us. The House proposed budget slashes from funding from Michigan Centers for Independent Living by nearly 40%, dropping from $19.7 million to just $11 million. For my center, Disability Network Southwest Michigan, that means a loss of nearly $500,000. That's not just a number. It's fewer ramps, fewer grab bars that keep people safe in homes and force more people into nursing homes because community support isn't available. Lost opportunities for employment, and job cuts for staff, over half of whom have disabilities themselves. We need to be clear. Short-term cuts lead to long-term costs. Nursing home costs Medicaid nearly $74,000 per person. By contrast, Centers for Independent Living help people remain in home and engage in their communities at a fraction of the cost. Every dollar Michigan invests in our centers stretches farther than almost anywhere else. With just 27% increase over the past 4 years, we've served 68% more people. That's efficiency, not waste. And make no mistakes, CILs are not hidden entities or ghost groups. We are regulated by state and federal governments. We submit annual reports. We are governed by volunteer community boards. This work that we do is transparent, accountable, and deeply rooted in the needs of the people that we serve. Over the last decade, Michigan has been a strong partner to CILs because it recognized that the investment works. To walk away from the progress that we have now will not only dismantle critical support, it would drive up the cost for taxpayers and set disabilities back by decades. This is not just a budget number. It's about people, our neighbors, our friends, and our family members. They deserve the right to live independently with dignity. So here's my ask to you. Contact your state representatives and your senators, whether Republican or Democrat. Call, email, text. Tell them to restore CIL funding to $19.7 million as included in the governor and Senate's budget. Tell them it's about protecting independence, saving taxpayer dollars, and building stronger, more inclusive Michigan. Together, we can ensure Michigan moves forward, not backwards, in supporting independence and inclusion for people with disabilities. Thank you.
Good morning. My name is Danielle Soledicki, and I'm the Chief Executive Officer of Prevention Works and a certified prevention consultant in substance use disorders. I want to speak today about what is at stake here in Kalamazoo County and in the state of Michigan. Behind every number we cite regarding substance use and violence, behind every statistic, is a child, a parent, and a neighbor. In Kalamazoo County, we've had too many statistics. Substances and violence has stolen our neighborhoods and our community. Opioids have hollowed out families. And yet, we know prevention works. We've seen it with our data, and we've seen it with our own eyes. When we invest in prevention, young people make healthier choices. Families find strength before crisis hits. Prevention Works and the Kalamazoo County Substance Abuse Task Force have already shown the power of community. Medication take-back programs have collected thousands of pounds of medicine that stayed off the streets and removed them from the hands of those in the community. Evidence-based prevention services have kept youth from ever starting down the road of addiction. And coalitions of parents, educators, and youth themselves are creating change that lasts. But this work is fragile. And if we cut funding to substance use, prevention, and intervention, if we reduce the substance use disorder block grant and other funding streams, we don't just cut programs, we cut lifelines. And let's talk about our young people. We know the hours between 2 and 6 p.m. are the most dangerous for high-risk behaviors. Across the state of Michigan, 1 in 4 juvenile crimes happens after school. In those hours, our young community members are either nurtured by opportunity or left vulnerable to risk. Out of school time and summer programs are not extras. They are shields. They are places where a 13-year-old meets a mentor, where a child discovers their talents and skills, and where justice-impacted youth find a second chance instead of a juvenile detention cell. In Kalamazoo, I've personally seen the joy on a student's face after a prevention class, the relief in a parent's eyes when their child has somewhere safe to go after school. and I've personally attended the reunification hearing where a parent worked to regain the rights to reunite their family. These services that help are not luxuries, they are essentials. We cannot balance the budget on the backs of our children. We cannot pull support from families fighting to stay whole. Cutting substance abuse block grant dollars and out-of-school time funding is not just a line item, it is a choice with real human consequences. So I ask you today, let's choose life over loss. Let's choose hope over despair. Let's continue to invest in prevention, intervention, and out-of-school spaces to keep our kids safe and our families strong. Because every dollar we invest in prevention today saves lives tomorrow. And every child in Kalamazoo and in the state of Michigan deserves that chance, because we know that prevention works. Thank you.
Good morning. I'm Jessica Glynn, Vice President of Victim Services at YWCA Kalamazoo. Thank you for being here today. I'd like to talk candidly about what's at stake for survivors and public safety if Michigan's budget does not include sufficient funding for the 115 organizations that provide life-saving victim services in our state. Our work relies heavily on federal support from the Victims of Crime Act, VOCA, but Michigan has seen a staggering 42% drop in VOCA funding in the past 2 years. That funding supports organizations offering life-saving services to survivors of child abuse, sexual assault, domestic violence, elder abuse, and human trafficking. This isn't just a budget line, it is a lifeline for survivors. Governor Whitmer's executive budget for fiscal year 2026 proactively responded to this shortfall and proposes an additional $20 million to serve survivors. YWCA Kalamazoo, along with the Coalition to End Domestic and Sexual Violence and all of our member partners, are asking for $75 million to pay for the true costs of keeping programs in place at their current levels. Because as critical VOCA funding has been lost, the cost of serving has only increased. As anyone who pays close attention to their grocery bill can attest, food and goods have risen dramatically in the last few years, and that includes food for survivors, rent for survivors, goods for survivors. Instead of addressing this increased need in our communities, the Michigan House's recently approved budget proposes deep cuts across the board. It proposes a $4 million statewide cut to victim services, yielding an immediate 30% loss of programming here in Kalamazoo. The Department of Health and Human Services faces nearly $4 billion in reductions, impacting Medicaid, behavioral health, food assistance, and human services. This is survivor money. Moreover, this budget eliminates entirely all appropriations for the Sexual Assault Kit Initiative in our community, effectively ending this program immediately. It eliminates entirely the address confidentiality program for survivors that was implemented last year and for which nearly 500 survivors have already made use of to keep themselves safe. It eliminates entirely the Michigan Attorney General's Human Trafficking Commission. And here in Kalamazoo, timing matters. Right now, Western Michigan University and Kalamazoo College students are in what's known as the red zone. That's the period from the first weeks of the fall semester until Thanksgiving, when more than half of all college sexual assaults occur nationwide. If YWCA Kalamazoo were forced to cut sexual assault services during this time because of state budget cuts, students assaulted on our campuses would have fewer places to turn, no trained advocates to meet them at the hospital, no one to guide them through reporting or help them navigate the Title IX processes. Survivors will be left feeling isolated, ashamed, and silenced just when they need our support the most. And let's be clear, when survivors don't come forward, perpetrators go unchallenged. That doesn't just endanger campuses, it endangers the entire Kalamazoo community. When VOCA funds evaporate and state support is slashed, survivors lose access to safety, advocacy, shelter, and critical legal support. They remain trapped in dangerous situations or fall into homelessness. Some survivors will lose their lives. Staff reductions and elimination of training mark law enforcement response, increasing the risk to every Michigander. Turning off funding isn't saving money, it's costing lives. These cuts don't just hurt individual survivors, they erode accountability. When advocacy and legal support vanish, perpetrators face fewer consequences, emboldening continued abuse. This isn't just a threat to survivors, it's a threat to public safety. Every advocate laid off, every cut shelter bed, every crisis call unanswered, all weaken our communities. We call on the legislature to pass the $75 million needed to keep these critical services in place for our community. Thank you.
My name is Cassandra Stewart, and I am the Director of Fund Development and Marketing for Milestone Senior Services. I'm here speaking on behalf of the seniors in our community. With the proposed cuts that have been, it is hard for me to think about the condition that our seniors will be in if these proposed cuts take place. We not only work with seniors, we also work with people with disabilities, age 18 and above. We need to have them have access in and out of their home safely, and we do that through our home repair department by building ramps for them as well as for seniors in our community. Simple things such as getting in and out of the bathtub, needing a grab bar to hold on to steady yourself as a senior. I want you to think about your grandmother or your grandfather not having that support when it is there, when it's needed. We have multiple programs for seniors. One, most people know about home delivered meals. The cuts that will affect. Our volunteer programs will be basically gone with the proposed budget. Meals on Wheels depends on volunteers every single day to deliver meals to thousands of people in our community every single day. We need those volunteers. We need to make sure that those seniors get the meal. Again, this is a lifeline. This isn't a privilege. We deliver meals to homebound seniors that can no longer provide or prepare a meal for themselves. And if that is what you want to take away, when we talk about independence, we're talking about living with some dignity in your elder years. I really need, we talk about the amount of money. I need you guys to just really think about the personal effect that this will have. You, our representatives, might have the financial means to care for your grandmother or grandfather, or your mother or your father. By cutting the Medicaid, especially for My Choice waiver for seniors that have no other financial means. This hits home to me personally. I have a sister right now, only 60 years old, with dementia. She utilizes the My Choice waiver program. I can't even fathom, without that program in place, how she would get the help that she needs. Okay, I'm not talking about someone 80 years old or 90 years old. She is 60 and has been dealing with this for 5 years. We need to get real and really understand the effects that these cuts will have, not only on our family members, but our neighbors and our church members. We think homelessness and mental illness is an issue today. With the proposed cuts, this will not even be, like I said, we think it's a problem now. But with the cuts coming, we won't know what hit us. With Milestone Senior Services, we deal with that. When I think of how many areas we serve people in, we have a behavioral health program. We work in conjunction with ISK, another nonprofit organization. We work with other organizations with Disability Network and helping to provide those ramps and those grab bars for people with disabilities. We work together. All of us aren't just individual nonprofits doing this little thing here and this little thing there. We have come together, and that is what we will continue to do to make sure we serve the people in our community so that they get the services that they need. And we need our House representatives to be with us so that we can continue the care that we know is needed in this community. Yes, we have given of ourselves as nonprofit workers, but we need everyone, not just the workers of nonprofit organizations, but we need everyone in our community to support what is so needed. We can't leave people behind. We're talking about health care. Imagine you going to the hospital needing it and your health care is no longer there. I can't imagine that for me, much less, a senior or anyone else with a disability that does not have the ability to go out and work a job for themselves. So we're asking you right now, yes, the numbers are unbelievable as far as the cuts that they want to do. Think about the people. It's easy to hide behind a number, but I want you to look at the face of each child, each senior, each person with a disability, and say, yes, I'm taking this away from you. We, as nonprofit leaders, cannot let that happen. And believe me, we're going to do everything that we possibly can so that it doesn't. So yes, call, text, go knock on the door, write a letter, whatever we need to do to our legislation so that they understand and that they see the faces. And I'm telling you this, as my sister was in the hospital, still in the hospital, but going back to that nursing facility, we need my choice waiver and the Medicaid program to stay funded, if not even where it is, to get more funding, because the need is definitely there. Thank you.
Good morning. My name is Jamaica Patrick Singleton, and I serve as the Executive Director of Cradle Kalamazoo. Cradle Kalamazoo is a collective impact of multiple agencies that is working toward eliminating disparities that lend to Black infant mortality rates in our community. When Cradle began, we were seeing Black babies dying at 4 times the rate of their white counterparts. And while there is still work to be done, Cradle is working. In 2023, data from MDHHS showed that the overall infant mortality rate in Kalamazoo County is 3.1 to 1,000 live births. The partnerships and programs associated with Cradle must continue so that our babies have the opportunity to reach their full potential. Decreasing infant mortality rates for babies only work if programs that support healthy birth outcomes and provide resources that address social determinants of health are funded. Last week, we learned that the Michigan Republican House passed a bill that cuts RX Kids cash prescription program. The full $20 million was removed. Regional Perinatal Quality Collaborative, the full $5 million was removed. Centering Pregnancy Group-Based Prenatal Care, the full $5 million was removed. Hospital perinatal quality payments to support maternal levels of care verification and MyAIM implementation, full $10 million removed. Michigan Clinical Consultation and Care, $5.3 million removed. There were also several key budget items that are currently funded as one-time that did not see support for continuation from the House, including SOS Maternity Network, full funding removed. Doula training funding, $2.9 million removed. Mama's Mobile Milk Transport, $500,000 removed. Understand that these are not just line item budgets. These are programs that impact how we provide services to families with babies. For example, the city of Kalamazoo was the first expansion community for the RX Kids program, launching in February of this year. Since that time, 633 families have successfully enrolled in the program. That's 633 households that have access to the funds to help meet their needs and improve the quality of life for our babies. One mom currently enrolled in RX Kids report being able to buy shoes for her son and not having that decision impact her ability to pay rent or utilities or buy food. The Regional Perinatal Quality Collaborative funds client assistance programs for home visiting programs in the state. These programs help people to avoid becoming homeless with their babies by helping with past due rent, past due utilities, and by helping to purchase baby supplies such as car seats and diapers. I implore our legislators, our representatives, the ones that we sent to Lansing on our behalf, to do everything in their power to ensure that we have funding for programs that are crucial to the health and well-being of Michigan families. Our children are depending on you. Thank you.
We've heard today from only a sampling of nonprofits who stand so much to lose this fall. And what we hear on repeat is that these upcoming state funding cuts will hurt people. If HB 4706 passes as proposed, there will be loss of life. House Republicans suggest their cuts eliminate waste, but our lives are not waste. September 30th is days away, and the time to advocate is now. We ask the public to contact your representatives, especially in the House, especially this week, and demand that life-saving social service funds be added back into the budget. Demand the removal of proposed state spending prohibitions aimed to hurt immigrant, queer, and Black Michiganders. Whether you live in Kalamazoo or in any other Michigan town, the cuts and restrictions in this bill are so profound that every community statewide will suffer. Our nonprofit coalition has mobilized to do all we can to protect Kalamazoo, and we hope that you will join us in solidarity. With that, I invite any questions from the room. None? Thank you.